So great to see everyone. Thank you, everybody, for coming today. My name is Shashika Bandara. I'm a PhD candidate at the Department of Family Medicine. I focus on global health policy and governance. We have an amazing panel for you tonight, and more interestingly, we also have an amazing keynote speaker, Timothy Caulfield. Our goal in organizing this event was to inspire our McGill community to come together and speak about these topics and to do more in communicating and advocating. So before we kick off, I want to do the land acknowledgement, and Isabel Munoz-Bolio will do the land acknowledgement.
Thank you, Shashika. So today, we want to recognize that McGill University is located on land which has long served as a site of meeting and exchange amongst indigenous peoples, including the Haudenosaunee and Anishinaabe nations. Today, we want to honor, recognize, and respect these nations as the traditional stewards of the lands, water, and waters on which we meet today. We recognize that this acknowledgement is only a small part of uprooting and challenging colonialism in Canada. Indigenous peoples continue to be disproportionately impacted and excluded from discussions in global health. In relation to our topic today, it is important to shed light on how language has been historically used as a tool of exclusion and marginalization. The erasure of indigenous languages affects how information is exchanged and accessed. It is therefore important to recognize the power of language to control colonial narratives and shape history. It is our responsibility to educate ourselves on the ongoing effects of colonialism and inequities in Canada's healthcare system, and to advocate for spaces for Indigenous people in global health. It is also important to celebrate and to be curious about Indigenous culture and Indigenous languages. With that, we hope to support Indigenous sovereignty and self-determination.
Thank you, Isabel. Before I invite Alua to introduce the keynote speaker tonight, I just want to explain our sort of inspiration for this event. We wanted to push more and do more in terms of communicating our research to the public, but also we want to do more in terms of advocating for change with policymakers. And I think every one of us can take inspiration from our panelists tonight and also especially our keynote speaker. I just want to let you all know, I tried to buy his book in Montreal. All of it is sold out. Amazon has 6 copies left, so you know the reach he has. If you haven't checked out his Netflix series, you should. With that, I want to invite Alua Kulenoa, who is the editor-in-chief of the McGill Global Health Journal, to introduce our keynote speaker.
Thank you, Shashika. Tonight, I have the great pleasure of introducing our keynote speaker for the evening, Professor Timothy Caulfield. He is an award-winning author, a prolific speaker, a researcher, and his commitment to fighting mis- and disinformation is illustrated in his immense body of work. Professor Caulfield is a Canada Research Chair in Health Law and Policy, a professor in the Faculty of Law in the School of Public Health, as well as the Research Director of the Health Law Institute, all at the University of Alberta. Throughout his 3-decade career, Professor Caulfield has shown a true commitment to improving the scientific literacy of the public. This dedication has been demonstrated through years of tireless media engagements to combat misinformation in the very spheres that it often originates within. His accomplishments across interdisciplinary fields of research and his highly influential work in scientific communication has earned him several accolades. In 2020, he was awarded the Sanford Fleming Award by the Royal Canadian Institute of Science. He has been named to the Order of Canada and is a fellow of both the Royal Society of Canada and the Canadian Academy of Health Sciences. Professor Caulfield is the author of several national best-selling books that have won awards, including, but certainly not limited to, the 2021 Science Writers and Communicators of Canada Book Award and the 2021 Alberta Literary Awards Wilfrid Eggleston Award for Nonfiction for his latest book, Relax, A Guide to Everyday Health Decisions and More Facts with Less Worry. In 2021, he co-founded and launched the scientific engagement initiative Science Up First on all major social media platforms. Showing a true dedication to tackling misinformation across all forms of media, he was also the host and co-producer of the award-winning documentary TV show, A User's Guide to Cheating Death, which streamed on Netflix in North America and was distributed in over 60 countries.
I'm going to take some time to introduce the panelists. The panelists, all of them I really respect, and they inspire me, and I think they inspire our community and around the world. So I'm going to take some time and do that because so you know the impact we are having through this. So I first want to introduce Dr. Tim Evans, who is the moderator. He is the director and associate dean of the School of Population and Global Health. He was Assistant Director General of WHO. He was a Senior Director of Health, Nutrition, and Population and Global Practice. He was a co-founder of the Gavi, the Vaccine Alliance, and I can go on. He has many accomplishments to his name. So can I invite Dr. Tim Evans to the... And... second, I want to introduce Professor Madhu. He is the inaugural chair of the Department of Global and Public Health. He's the associate director of McGill International TB Center. He has an amazing Forbes column that does what Tim talked about, debunking and pre-bunking. He also lifts up communities, youth, and LMIC partners through his column. So I want to invite Madhu to the table. I want to introduce Dr. Annick Gauthier. She is an assistant professor at family medicine. She's a physician, a virologist. The community in Ganawake actually recognized her amazing contributions to their community as a communicator and also an expert. I also found out that she contributed to the Nobel Prize-winning team at Charles Rice's research team back in New York for treatment for hepatitis C. So I want to invite you. Last but not the least, Dr. Ananya Banerjee, Assistant Professor of School of Population and Global Health. She is also the lead of Equity, Diversity, and Inclusion and Anti-Racism at the School of Population and Global Health. Ananya is an amazing empowerer of students. She goes out of her way to build community, to strengthen communities, and you can see it in her work in Park Extension on reducing vaccine hesitancy. She writes to the media about other things as well to advocate against racism, for structural injustice. And I have never seen a professor who is more popular with students at McGill University. So I want to invite Ananya to the table as well. So before the panel discussion starts, I just want to give the lay of the land. Tim will, of course, take over and moderate this session. And then we will have a Q&A afterwards. And I also want to remind all of you to delete the TikTok dances you made about this talk, because you cannot post them anymore. So with that, I'll hand it over to Tim. Thank you.
Yeah, thanks for that. And I just want to begin by asking Timothy a very personal question. I'd like to know how many vaccinations you've had, COVID vaccinations.
I've lost count.
Okay, so now I understand because
4 or 5? So 5.
Because I think the talk speaks to magnetism.
Oh.
So I'm believing the conspiracists. If those vaccines are indicative of the magnetism of your talk, then there's truth to what they're saying. Thank you. That was truly really inspiring, just because of the energy, but the whole scope of what you covered. And so I know that has provoked all sorts of great thinking in our 3 panelists. So I'd like to begin by asking the panelists to reflect a little bit on your talk from their personal perspectives, because each of them are dealing with this in in their own ways as part of what I call the science community linked to academia. And so we'll just begin with a few candid reflections from each of them on things that, in thinking about Timothy's talk, what were the things that were flying through your mind in terms of, wow, how am I incorporating these issues into what I do on a daily basis? So, Annick, you've been given
Apparently
the
I've been
first
given the
opportunity to move forward.
So there are so many amazing, fun things, and like Madhu, and we're chatting on the side while we're like listening. But one of the things that I think it's the biggest opportunity is you have this one slide that had a picture of kids learning, and I've always thought that educating youth is the best way of educating everyone. So there's, again, yeah, you're right, there's a lot of young people here, but the older people, how many of you remember home economics, the home ec class you took? Okay, I took home ec, okay. So that home economics class has not existed really for many years, for at least 20 years in Quebec. I believe that we need to recreate some type of home economics class that it's like home economics plus. So at my daughter's high school, public high school here in Montreal, they started a class and they call it consumer science. It's a combination of home ec, learning how to write a CV, learning how to deal with banking. And the one thing that I think is missing and I think is needed, and this is going to really affect misinformation, is learning how to critically look at evidence and what's going on around you. And if we teach the children young, and I have this whole plan in my head of like something in grade 7, and then another class in grade 9, another class in grade 11, where you learn some basics of first aid. When do you actually go see me as a family doctor? When do you need to? When do you don't? Where do you get your information from, and how do you judge that? And if we educate them, that actually goes and spreads into the families. So, same with smoking. If you think back to the day, seatbelts. You all probably, most of you grew up with seatbelts, but I remember when my grandfather refused to wear a seatbelt, and he cut them out of the cars. But it was my brother and I insisting that we would not go anywhere with him if we didn't have a seatbelt on that created the change. And we know that youth can create change. It doesn't have to just come from the adults. So that's one of the things I was thinking of.
Great start. And I like the fact that you've invoked youth, because I consider myself amongst the youth. It's never too late to learn, but and in some respects, some of the more important early work in what we then called tropical pediatrics was about young children bringing knowledge to bear on health promoting opportunities. So thank you for that. Ananya, over to you. What are your initial thoughts in terms of your own realm of what you're doing?
So I'm debating, should I tell a personal story? Should I tell an academic story? I mean, there were so many vivid memories coming across my mind for, during the pandemic as Tim was talking. I was like, oh, okay, that makes sense now, why that person reacted that way, or why communities were like, having so much mistrust and just being overloaded with misinformation. But I think definitely we need to work with the youth and build their critical thinking skills. I also feel like, given that we knew so many systemically marginalized communities, who have a historical mistrust in medicine and science, I think what was really neat about the pandemic is that we saw actually vaccination rates exceed compared to, the greater population. So for example, Park Extension was an example, right? They were falling behind in Montreal in terms of the vaccination when it first rolled out. And then all of a sudden we see in the media, they're a success story. Like they exceeded the rate compared to the greater Montreal area. I think what was really cool when I went into the community and, we started to talk about why was this, we embarked on a huge qualitative study. We realized it was trusted leaders in the community, who didn't have a science background, but had a lot of trust in the healthcare system, right? And many communities really do trust physicians. And I really believe that when we are working with community leaders, where the general community, members of the community trust them, and then the community leaders trust the physicians, you kind of see this like multi-pronged approach. And then all of a sudden, we just saw the rates spike up because the community leaders or activists who are well trusted in Park Extension were going door to door and telling them why this was important, right? And I think enabling the story of we need to protect our community because we're already vulnerable was very powerful. And so I think we need to invest more in those trusted community leaders, make them health ambassadors to really help overcome the misinformation. So I actually ended up telling an academic story, sorry.
No, not academic activism, because there weren't so many academics that actually got into the community, and the ParkX example was a terrific one. So we have invest in youth, young people, and really invest in trusted community leaders and get them into community to talk to people. Madhu, you've got a tough act to follow. How are you managing this in terms of your realm and sphere of activity?
So I have many stories to tell too, but I think I'm, as much as I worry about the celebrities and cranks and trolls and all sorts of weirdos spreading misinformation, I'm equally worried about scientists. Okay? I don't think the pandemic was a shining moment for many of us in the scientific community, doctors, public health people. We've done some seriously bad stuff, okay? And I'm going to give you a concrete example. Somewhere in the middle of the first year of the pandemic, there was a researcher who I later learned works on mouse brain signaling or something like that. He sends me an email. Professor Pai, I am doing this analysis of BCG vaccination in various countries and the COVID rates. And then look, there's a beautiful correlation. Countries that give BCG hardly have any COVID. And therefore, I think BCG works for COVID. I'm like, whoa, this is epidemiology 101, right? This is ecological analysis. Most of the countries you're talking about virtually have zero COVID testing. That doesn't mean they don't have COVID. And I kind of explain all of this and clearly sent him a thing, do not push this out. What does he do? Pushes it out on preprint, instantaneously goes viral, and the guy jumps onto national television in India and pretends like he's the world expert on BCG, which he knows nothing about, COVID, which he knows nothing about, and then tells the world, yeah, let's start vaccinating people with BCG. And the Indian government is threatening to vaccinate 1.4 billion people with the vaccine with zero randomized evidence on its efficacy for COVID. It doesn't even work for TB well. Forget COVID. I'm like falling off my chair. I had warned this dude, don't do this. And that's exactly what he did. And then I wrote a piece in Forbes. Thankfully, I had a platform. So I wrote a piece in Forbes saying, BCG and COVID, tone down the hype, go and do the research. That started a whole wave of randomized trials. And like Tim said, millions of dollars and dozens of randomized trials later, today we know BCG does nothing for COVID. Nothing, not even a blip, right? Millions of dollars later, we have the answer. But at that time, that piece that I wrote has been read 267,000 times. Nothing I've ever written in my academic life over the last 50 years has been read 200K times by anyone, which shows that I was debunking something and it has traction. And then I worked with the Indian government quietly behind the scenes to say, do not go around vaccinating people. Do the research, right? But I'm disappointed as hell that our own fellow scientists could not contain their excitement, bring critical thinking that Tim is talking about. These are PhDs. These are public health people. These are doctors. I can totally excuse someone uneducated who's tweeting that you become a magnet when you take COVID. But I cannot condone PhDs and MDs doing BS like this. Somewhere along the line, we lost the plot as scientists, and it's for a good reason that I think the public trust in scientists has declined considerably. The masking is a whole another story. Some of our scientists have done egregious things against masking, and I cannot condone that, right? So I think the whole world needs an Epi 101 course, and that's exactly what I started doing. During the pandemic, I started teaching free courses for journalists on Epidemiology 101. I ran 3 Zoom courses, uncredited. McGill didn't even know about it. I just did it, right? Because the need was so much. Like, what is an ecological study? If this dude had known that it's egregious to take an ecological study when you're just comparing countries with such vastly varying testing rates and whatnot, and come up with this crazy conclusion that you need randomized evidence before you decide on whether a vaccine works or not. Any of our EPI department students would have nailed it in 10 seconds, but not this PhD, right? So I think I really want scientists and doctors and health professionals to become a lot more critical in how we think about it and not jump into what we call epistemic trespassing. How many of you have heard of this term? Epistemic trespassing. There's a whole piece that I wrote in Forbes on this issue. If you're a mouse brain scientist, stick to mouse brain work. Don't get into shit that you don't understand. In this case, I'm not begrudging anyone wanting to contribute to a pandemic response. But if this is really not your lane, like, would I ever dream of waking up one day and writing a paper on mouse and brains? Not in a million years. I neither know mouse nor do I know brains. So why would I write about things that I don't care about? And yet, during the pandemic, our own colleagues decided overnight that I'm going to become a COVID scientist. People who've been working on Alzheimer's in dogs decided they're going to become a COVID scientist. And that led to phenomenal amount of epistemic trespassing. When you jump into an area that is not yours, you can do some serious harm, right? Just sticking to our lane was the best thing that we could have ever done for science. And this has been massively studied, and I love for Tim to respond to it. This is one of the reasons why there is so much misinformation. People stepping into domains where they neither have the educational training, nor can they spot their own mistakes. One of the best things about being an expert is knowing the limits of your knowledge. If I'm the expert on TB, I know 1,000 things that I don't understand about TB. But if you're not working in TB, you think you know everything about TB. Right? Humility and not jumping into areas that are not ours are massive issues.
Great. Well, thanks, Madhu. I think you've brought in some of the elements of Tim's checklist that I took pictures of, but I'm sure many others. And there was on that list humility. And you've introduced, in addition to 2 things that make a difference, is this issue of respecting boundaries in the context of no epistemic trespassing. The challenge, of course, is that there were no SARS-CoV-2 experts because we hadn't seen the virus before. And so in the absence of expertise, it was free game. And so I wanted to use that as a segue to a question in which Tim will invite you to give perspectives, but also the other panelists. We saw the science community move very early in 2 different ways. We had the Great Barrington Declaration, right? Which said, let the virus run wild in young people where it doesn't really affect them, protect the elderly, and we'll get to herd immunity quickly. That was one, and the costs of lockdown or the consequences of lockdown would be so great that it was much better opportunity than locking down everybody. And then shortly thereafter, we had the John Snow response from the other side of the Atlantic, which was pulled together by The Lancet, and basically said, the Great Barrington is all wrong. This is right. At a point when, quite frankly, 4 months into the epidemic, if we follow your thinking, Madhu, and were honest, most of us still knew almost nothing. Right? There were many of us who still felt it was respiratory spread, that it was a droplet and not aerosolized. Right? So just to say that we have had this hubristic polarization of science in May of 2020. So Tim, tell us, what do you take from that polarization, and is that something which we can cure with epistemic no trespassing? Or is there something else that we need to be thinking about in the training of scientists that would perhaps invoke a stronger sense of caution and humility?
Epistemic trespassing is my middle name. There's no realm that I won't. I actually find the question fascinating because I actually think it, with all due respect, it speaks a little bit to a false balance that actually played out at that time, and our own research demonstrates. The Great Barrington Declaration, that approach, was actually held by a very small minority of scientists and researchers from respected institutions, but it was a minority, and a very small minority. And it was also almost immediately critiqued, not just in the from a scientific perspective, but also sort of from a conceptual perspective, like, how is this going to be operationalized? From an equity and health policy perspective, before even the John Snow commentary responded. But the polarization in the public's mind was already there. So, and I also think what I meant by that was that there was this perception, I think certainly with politicians, we see it in the United States, we saw it in the UK, that this was that there was the community, the scientific community was kind of split. And we go the Great Barrington Declaration approach, or we go this other approach. And the other thing that happened, I think, is this perception is it's full, and we're still seeing this now. We saw it with the Manning report in Alberta. It was this idea of full lockdown. Like, it's like we were all spending 2 years in our basement and with our windows shut down. I don't know where this happened, where this lockdown happened. In most places, there was this huge variability of response. And the piece we wrote, we said we didn't like the term lockdown because there was so much variability in response. Versus this approach, so to create this false dichotomy, when the reality was there was this plurality of responses that was sort of scrambling to use the uncertain science to do the best they could to tackle this unknown enemy, not full lockdown versus the Great Barrington Declaration. But that perception lives on today and it informs public discourse today. And I think partly because of those early day representations. But I agree with you. I think the mistake that, I hate to use the word we because it sounds like a conspiracy theorist, we and them, but one of the mistakes I think we made is we were too dogmatic in our language. We didn't respect the scientific uncertainty. And in part, and I know there's science communication experts here, part of it I think is, the rules for science communication and public health is be clear, be certain, this probably better than I do, give actionable suggestions. And we were drawn to that. So I think we were too dogmatic, and that fueled, I think, the polarization in addition to that. So I think one of the lessons that we have to learn is, I think we can still have an actionable, clear message that respects the scientific uncertainty, respects the idea that science moves iteratively, and speaks to the stuff we don't know. This is the best we can do now. We may learn in the future, and our recommendations will change. But I do think we need to avoid that kind of polarization, characterization that fuels the discourse that we have right now. I could go on, but I should shut up.
Great. So I just give the opportunity to the other panelists to make any comments on this issue of the polarization of science, the hubristic epistemic trespassing which Madhu described, but which we saw in other domains as well. Any thoughts on that, Annick?
I have a little. So I was very blessed and grateful that the community in Ganawage, where I was a family physician at the time of the beginning of COVID pandemic, allowed me to answer questions for the community. And I think that's actually the advantage. So I'm not on Twitter. I actually made the mistake of looking at Timothy's Twitter last night, and I just felt bad for humanity, not because of his lovely comments, because the comments people make are just ridiculous. But I like being a family doctor. I actually take where the people are. And so when I have someone coming to me and bringing me information, whether it's dogmatic, whether it's yes and no, what's happening, I get to actually have that great use my PhD, as my dad had told me. I became a doctor later in life, and my dad, everyone else's father would be like, oh yay, my daughter's becoming a doctor. My dad was like, don't lose your PhD in virology. And so I actually take out pieces of paper and I draw out things and explain things. And one of the big things I explain about science is that science is not black and white. It's a collection of grays that over time go to be more dark or more light. And that's what you have to understand is science. And so when I would go on, I did Facebook Lives and I would do radio interviews weekly, daily at some points. I would take the questions that were coming from the community and then feed back the answers as best as we knew at that point in time. And that's what true science is, and that's how we have to communicate it. It's not sexy. Sexy is the Nicki Minaj things and things like that. Like those things are the sexy things, but you have to actually break down to what we know at that moment.
Great. Well, that's a lovely illustration, and I think your definition of science is in that realm of uncertainty and trying to get a better sense of things that seem to be resonating and becoming more true, or where we think there's truth. Particularly important, recognizing especially that our enemy was changing its tactics much more regularly than any of us ever imagined, I think, at the outset of the pandemic. Now, as an ardent nationalist, and I won't define what nationality I'm talking about, because I have multiple, I would like to shift this next conversation, or direction of the conversation, to reflect on the 49th parallel. Tim, a lot of your examples were of our neighbors to the south. And as Ananya mentioned, Canada, despite all that misinformation, we had an incredible uptake of vaccines. Something like 90% of eligibles in that period of January 2021 to September 2021 got their 2 doses, right? Some with an extended dose interval, some with the regular, but overall, and in communities which otherwise were at much higher risk of infection because of all sorts of forces of exclusion, good work meant that, in fact, their vaccination rates were not much behind, and in some cases ahead. So is this a Canadian effect that we're somehow immune to misinformation? Or is this just a lag effect? Is that we're not quite there yet, and we can expect to have the same troubles once the misinformation virus permeates across the 49th parallel? What do you see?
Tim, you can guess my answer. We have that. We have the problem now. And so first, let's start with the positive. I don't think it's highlighted enough the success story that has happened, right? I really don't. People, misinformation. There's no point for. You'll remember the early days. There was a lot of hesitancy for the vaccine, right? And I think some studies put it even at like 50%, and through good science communication, through meeting patients, through community work, we really made a big deal. And the same with masks. Like, you think of the percentage of, we went from 0 to, is it 87? I can't remember what the number, really, really incredible. And that's a behavior change, which is in public health, that's not easy to mobilize. We forget that. But we also know if you look at the numbers now, in some ways it's more stark, because look at the uptake of the boosters. Look at, if you go out right now and you ask, this work has been done, the skepticism in the COVID vaccines has gone up. The skepticism in Canada about vaccines generally has gone up. The hesitancy around childhood vaccination, yes, it's still, I think it's 83% or something, but I think it was an 8% decrease in hesitancy for childhood vaccination in Canada, which is huge. That's huge. Doesn't sound like a lot. It's huge. And that is almost entirely the results of hesitancy. And that hesitancy is almost entirely driven by misinformation emanating largely from the United States, but not entirely from the United States. And I do also want to talk about this issue of trust, because we haven't brought up that word enough, I think. The trust issue is coming up a lot, because they're saying, of course we don't trust institutions anymore, and they're kind of trying to put the blame, I sound like a conspiracy theorist, but for brevity's sake, on the institutions, because we did screw up. Institutions did make mistakes, but most of the distrust right now is fueled, I believe. Yes, it's complex, and I want to be careful not to overstate this, but a lot of it is fueled by misinformation. The misinformation mongers, one of their primary goals is to create distrust in institutions, especially state actors. And that creating distrust in institutions makes more room for misinformation, and on it goes. So the trust in healthcare professionals still incredibly high, in science still high, and scientists still high, but in both Canada and the United States, it is decreasing rapidly, and it's largely among a particular ideological cohort, and you can guess who, which also speaks to the fact that this is largely about ideology and largely about the embrace of misinformation. If you go out on the street right now and you ask the public, someone, 2 or 3 questions, are you vaccinated? Do you think ivermectin works? I can tell you their position on 20 things. And it wasn't always like that, right? And I could go on. Sorry, you see, you wound me up a little bit there.
Well, no,
I will pause there.
We like to wind you up. It's that 7th dose you had, and it's radiating. We understand what's going on here. But any other reflections on the Canadian good compliance, incredible adherence, uptake, masks, vaccines, and are we at risk? What is your sense? Or is there more resilience in the Canadian population because we've got great family practitioners who know science? What do you think? Any thoughts on this?
I agree. There's actually the misinformation and disinformation has increased. And so of my patients who did get dose 1 and 2 and even 3 easily, the question is, do I still need to be vaccinated? What do I do? What do I do with this other vaccine that's coming out? Do I really need that? Did you get that, doctor? That's the question. And I think those are all legitimate questions, and understanding people's different risk level is super important. But how do you spread the correct information to people, and how do you go about doing that? I think that's where, so I'm going to bring it to the grad students that are here, because so when I was a grad student at UBC in the 90s and 2000s, I was part of something called Science 101 and Humanities 101, where we took busfuls of people for free, mostly coming from the downtown Lower East Side, coming from there to UBC twice a week. One day was science, another day was humanities, and we would teach them what they wanted to know. So this is the lowest socioeconomic status in Canada at the time, high rates of drug use. And we would take the people as they were, and we would feed them a little bit, give them some education, talk to them about the different things. And those kinds of things are really important, and a way of engaging, like Ananya said, engaging the population. So I look to the grad students in the room to start those kinds of things. It was so much fun and so enjoyable, and that we would do this, semester after semester. Yes, like Madhu, although UBC was aware of it, they didn't know, like there was no credits involved, and I think they gave us like the space for free to do it. But those are kinds of things that we need to do to prevent the misinformation that we know is spreading. And so some of these people just don't have the opportunity to sit in rooms like this and have these kinds of discussions.
Great. I love the point, taking science to the people. And it sounds like at UBC, like Madhu teaching Epi 101 to the world, the best thing was not to ask for permission, simply for forgiveness. So, excellent. Ananya, any thoughts on this question of Canadian resilience or strategies for sustaining perhaps a science attention to evidence and not getting duped by the bunkers?
Yeah, I mean, I think we need to keep the momentum up. We've lost the momentum, right? I mean, if you think about when the pandemic started, you can see how many dollars went into research to create, powerful health communication campaigns. There was money being invested into communities, like design your own vaccination rollout program. Like I still remember in Ontario, where I was at the time during the pandemic, just to see the level of community mobilization was just I've never experienced that in my life. And I teach a course on health promotion here at McGill. I teach about health behavior change. And I think what was so incredible is just when we saw this mobilization, particularly among racialized communities. If you remember, we were predicting that they would be the least likely to get vaccinated because of access, but because of misinformation that was being spreaded, particularly among immigrant communities, right? They were receiving so much information here in Canada, and then back, I know from my mom, her WhatsApp group with all my aunties, and like things were being spread, like things where my mom was telling me, even though she was like fully, pro-vaccination. And then I was looped into those WhatsApp groups to start like literally policing my family and being like, stop sending this information among our group and to everyone. But I think that was really powerful because even within racialized communities, so a great success story is the South Asian COVID Task Force in Ontario. It mobilized South Asian physicians, healthcare professionals, community leaders, students who were in public health and medicine. And we knew, for example, in the South Asian community, they have an incredible high trust in physicians. And given that within our second generation, many of us are now professors, we're physicians, we really wanted to leverage on our power. So we inserted ourselves into those WhatsApp groups. We were monitoring on our parents' face group pages in terms of what they were sharing. And we were like, I went into my mom's account and I took things down. Like I was like, no, right? And, I had to do it. But, at one point, they started to respect us. And then also during the vaccine rollouts, my friends who were physicians in the community were administering the vaccines. We started to have the rollouts in faith-based institutions, imams, priests, pundits. They were out there and they were combating this misinformation, right? And they wanted to be the credible source. We didn't want those WhatsApp groups to be the credible sources anymore. And it's really sad how that, mobilization and the power of community has now dwindled down. And that's because we're not getting the ongoing investment and the funding from our public health units as we did when, it was such a crisis to curve the pandemic. So I think we need to keep that momentum up, and not just in the context of COVID, but in all different types of public health epidemics that are occurring, particularly in very vulnerable communities in Canada.
Great. Yeah, you definitely can. And I think you've got an ambassador for science up first.
Oh my God. That's the first thing I was going to say. You have to join Science Up first. Okay, I've done that. But one of the challenges, I wonder what you all think about this, is the community now that is the greatest challenge is an ideological community, right? In the United States, the strongest predictor of whether you're vaccinated or not is whether you voted Republican, more than being black, more than your insurance coverage, more than your economic it's more than your education. It's if you vote Republican, right? And so how do we mobilize that community? Now, Frank Graves' data, the pollster that I often work with, I recently had an election in Alberta, and I want to make sure I'm not hyping this data. I have a slide on this. I took it out. Of vaccinated people, those who are fully, I know what it is. Unvaccinated people, the number of them that voted for the NDP, zero. Zero. Number of individuals who are unvaccinated who voted for the NDP in Alberta, zero. Now, I think he's done the data since then, and it's moved up to like 1%, but it's all about ideology now. And so that becomes much more challenging, right? It really becomes more challenging. There was a study that came out this summer that found that once it becomes about ideology, you start to ignore fact checking. Those kinds of things don't mean as much to you. They don't have as much persuasive force. So how we mobilize that community to make a difference, I think is going to be one of the great future challenges.
So I think Madhu you want to come in on this, and given that you've been vaccinated so much, it means that you must vote NDP, Madhu.
So I want to kind of strike a sobering note, and Tim touched on it, but I think we should just outright openly talk about it. The world at large is seeing a steady rise in far-right, ultra-nationalist, populist, autocratic governments. Everywhere in the world, that's the trend. And if that's the case, US offers us a textbook case of what can go wrong. Because the whole populist playbook, right-wing, is essentially runs on anti-science. Okay? Anti-science is part and deeply inherent in their playbook. Anti-science, anti-public health, anti-vax, anti-scientific institutions, like how Trump decimated CDC, right? And the Fox News. All of that goes as a package deal. And they will also go after women's rights, reproductive rights. It happens like clockwork. And you and I may be sitting here next year with the Conservative Party in leadership. And don't even think for a second that Canada is safe. We are not. It is the worst thing to kind of compare ourselves to America and say we are in a great place, because nothing is sacrosanct. Nothing. Hundreds of years of good institutions can be destroyed by bad leadership in a matter of years. Look at Argentina. Look at the leader that they voted right now. He's already started decimating science in Argentina. Netherlands, Italy, you name it. Bolsonaro, what he did with Brazil. This is the global trend. And if Canada flips next year, if US flips back to Republicans next year, all of North America is in deep shit. Okay? And scientists like us will be left dealing with the consequences of it. Everything from rollback of reproductive rights for women, all the way to public health, decimating of public health agency, cutting back on science, muzzling scientists. This is what they will do because we are a threat to those leaders. Anyone who's a scientist is a threat to them. They do not want us. They do not want us talking. They want to control the narrative. Right? And the Fox Newses of that world will amplify them. And we are all left dealing with this, which is why I don't believe we can ever control misinformation by just focusing on technical issues. We've got to get political, which means you and I have to go out and vote. This is a matter of life and death. We just cannot sit back here and be in our scientific ivory towers and say we got this. Because if you don't show up at the polling booths, you know what's going to happen. Bad stuff happens when we relinquish our democratic obligations. When we do not show up at the polling booth, we've seen disasters happen time and time again. Public health is political. Science is political. And the solutions also have to be found in the political realm. Just that one point that Tim made, who you voted for, made all the difference. And read Peter Hotez's new book, the most terrifying public health book I've ever read in my life. Okay, The Rise of Anti-Science. He cuts it to the bone on who is funding these right-wing groups, where is their money coming from, who is making money out of ivermectin, and why. All of this matters. It's not just one or two cranks. There's a whole industry fueling anti-science and anti-vax, and they are in Canada as much as they're anywhere else.
Great. So, Madhu, with that, I'm going to take your clarion for getting democratic and going to the people and open up the discussion. It's time to hear from all of you. Questions, comments. You've got 4 sitting ducks who are ready to respond, and I will make sure that you get some response to whatever comments or questions you may have. So please, there's microphones circulating, and I see the chair of the Department of Family Medicine who's going to lead us off. Dr. Dove, please.
Thank you. Thank you. Is that working? Yes. Thank you so much for this talk and for the panel discussion. I thought it was fascinating. I am also a family physician, and I really appreciated Annick's comments about talking to your patients. And I think maybe really the solution is more family doctors to talk to patients. What do you think of that idea? But seriously, in addition to that idea, I'm curious about the mechanism by which everything is so polarized now. So I hear you, Professor Caulfield, about how somebody voting Republican will predict how many vaccines they've had and vice versa. But how did we get there? And like, what is it social media only which really reduces and simplifies all arguments? Because what I was hearing from the panel was that during the pandemic, if you had actual discussions and you talked to people, like those actually work. So I'm tending to believe that it is social media and capitalism that is reducing everything to very simple and polarized arguments. But maybe you have a more nuanced answer.
Great. So just a terrific question. And you've thrown down the gauntlet. So next questions, get ready, because we expect further tough and interesting questions. So we'll come back. Tim, and maybe some of the other panelists. Tim, over to you.
It's a great question, and I think largely, not entirely, your intuition is right, and by that I mean, it really is the incentives baked into our information environment, and from not just social media, but cable news, the death of local news and newspapers, the death of journalism more broadly. Those things matter, and I think we have an emerging, pretty solid evidence base that suggests that these forces really are driving us apart. And I think it's easy to think that social media is a niche thing. It's not a niche thing, right? I mean, I have 4 young adults, kids, and that's where they get their information. My youngest is an engineering student. I like to think he's smart, and he gets all of his information from TikTok. When I see him lying on the sofa, I know he's looking at TikTok, right? And TikTok is used as an information source. It's used as a search engine. And so we need to recognize that, because those algorithms are driving us apart because they benefit from that polarization. We've done a lot of research on search engines, right? And that first page of a search result, you Google something, and that's increasingly that's how human beings, that's their information universe, right? The first page of a Google search is where do you hide a dead body? On the second page of a Google search, because no one goes there, right? It's that first page. And our own research has found it's just filled with misinformation and polarizing misinformation, right? So I think this is one of the reasons we're here. And of course, politicians, as you've highlighted, autocrats love polarization. They thrive on it. They try to create it. And so we've seen political leaders exploit this situation. Now, of course, what we need to do is figure out how we can break down those echo chambers, because research also tells us if you talk to people, we're often not as far apart as we think we are, right? And we often have shared values, and we often have shared goals. And there's been some really, I actually took these slides out because I was already way over. There's been some really interesting recent research. It's preliminary, that talks about focusing on those shared, bypassing misinformation, focus on the goal, and you can move the needle. And the other thing it's found, which I think really builds on your work, again, very recent preliminary research, that if you have diverse voices at play, you are more likely to implement critical thinking skills because you know that other voice is near. Right, so you're more likely to be careful about how you talk about issues, but also more likely to use critical thinking skills. So polarization is out there. That's the incentive structure, unfortunately, that is baked into our system. We've got to figure out how to break down those barriers.
Any further comments on this? I know somebody has a conflict of interest in terms of the recommendation for more family doctors. But any further thoughts on this question that Marion's raised on what's really driving this?
Yeah, I mean, social media is so evil. Like my partner's a computer scientist, has told me over and over again, just disconnect from social media. And I think what's been really scary is like thinking about Twitter ever since it's been taken over by Elon Musk, right? Like the level of polarization that has been created ever since he's taken over, like we have seen it, who've been on Twitter for years, right? And it's fascinating even for myself. Sometimes when I'm trying to like provide health promoting messages, they're just being watered down by some algorithm, and like, just the misinformation just is like spreading like wildfire. So I think there needs to be a way to like really also reinforce like regulations of some sort. And it's really scary, to see how like social media is like probably a well-trusted source. I'm sure there's data on it that even just goes beyond your own like personal networks. And so we really need to start strengthening our personal networks again. I mean, talking to your neighbors. Like my mom was a huge ambassador in our neighborhood. I mean, we had a lot of young families with a lot of young kids who were very vaccine hesitant. And it was incredible to see how my mother, as seen as the elder in our neighborhood, was actually convinced so many people in our neighborhood to get vaccinated. And she wasn't like knocking on the door, you're gardening, people are walking their dogs. Hey, how's it going, Namita? Hey, good. Did you get your vaccine? I got mine, right? And like, oh, I don't know, I'm unsure. And she would sit there and she would actually talk about it. And this is a lay person, like who doesn't have a science background, but really was invested in the welfare of our community. And I think again, we need to figure out how to create those like personal connections through conversations, whether it's with our family physician, whether it's with our neighbor, whether it's like our faith leader, and so forth. Because the reality is we are becoming more and more disconnected as humans, and we're losing trust in each other as humans.
Great. Thanks, Ananya, for that. Other questions? We have Kate here at the front. Kate, right here at the front. Yep.
This is so exciting. This has been a wonderful discussion. I would love to talk about the need to build science literacy from kindergarten right on, but I want to ask you more about how to talk with people with these really hardcore divergent views. And I think of Catherine Hayhoe, who is an evangelical who was head of Obama's climate mission for the Paris Summit, who talks about how you need to find that common value somewhere. You have to build the relationship. You have to show empathy for the situation they're in. They're not in the majority opinion, and they're hardcore at it. So just some advice for us as to how we can approach people who are non-believers and against what we think is the science and the knowledge.
It is, if you're talking about the hardcore denier, it can be extremely challenging. And, I'm always an optimist on this topic, glass half full kind of person. But the two things that are making me a little bit more pessimistic is the rising role of ideology and AI. Those two trends, I think, are making it more challenging. Having said that, there is interesting literature, and I'm sure my two clinical colleagues are going to be more familiar with these strategies. But it's the obvious stuff holds true. You listen, you be patient. No one changes their mind in front of you, right? No one goes, now that you mention it, Tim, you're right. No one ever does that, right? Give people a path to credible information. Have community, there's good research on this, have community voices, participate in the conversations. And I am intrigued by this idea of shared values. So the study that I took out was on GMOs. Because and I think that's really valuable because, again, that is sort of different end of the political spectrum in general.
Tim, GMOs?
Genetically modified organisms, right? So there's a lot of anti-GMO rhetoric, and it's almost all entirely inaccurate. And and it's coming from a particular corner of the ideological spectrum. So it's an interesting example. But what they found is, if you talk about those shared values, feeding the world, trying to do what's right for the environment, they suggest bypassing the misinformation and focusing on that shared goal. And again, they were able to move the needle. They weren't necessarily going to change things overnight, but the strategy did work in this study. And I think my own sort of anecdotal experience is it makes a difference, right? When you talk about those shared values.
Great.
I actually have a question for you, Tim. You remember when Peter Hotez was invited by Robert Kennedy to debate him on whether vaccines work or not on Joe Rogan's show? Peter decided not to. And I think I was asked once that there's another notorious anti-vaxxer, anti-science guy, Steve Kirsch. Oh, yeah. So this guy is going to debate another scientist. Can you be a judge? We'll pay you $25,000 for judging this I'm like, Jesus Christ. First of all, I'm terrified that they picked me to be a judge. I mean, what does that say? They thought I was on the fence about vaccines, for Christ's sakes. Have they not seen my Twitter thread for 3 years? I was outraged to even be asked, okay? But when you are put in this dramatic situations, are we legitimizing the other side by even debating them? It's one thing to talk to your grandmother who is on the fence. It's another thing to talk to a hardcore anti-scientist and just platform him and then get murdered in front of him and his troll crowd, which is what would have happened between Robert Kennedy and that guy Joe Rogan. They would have decimated, no matter what Peter Hotez had said, he could have never won in that debate, no matter how much science is on his side. So what do we do when we are put in this situation as scientists?
Yeah, this happens to me often. And there was a Canadian anti-vaxxer. I'm not even going to use this individual's name. I've been challenged to debates often, right? And they never really invite you. They say that you're invited. The invitation happens on social media. I don't get a formal letter from an institution, right? And then they print up posters. And the poster said, invitation accepted, and then an X through me. And then they hold the event. They hold the event, and I'm not there, right?
Your poster is there.
Yeah, I'm not there, and that gives you an opportunity to call me a coward, right? That I couldn't come, and that I'm not for marketplace of ideas. But I think it's clear when it's a hardcore. It's a publicity stunt. It's a misinformation strategy, and all it does is legitimize these views, right? That's all it does, and that's what they want. They want to use. It's a no-lose situation for them, right? The same thing happened to Peter Hotez, right? So I think so when we're talking about finding common ground, we're talking about when there are people who in the public that have genuinely want to have answers. And I'm curious what you guys think about this. My rule is, you never make fun of someone in the public. You never make fun of someone who's just trying to do what's right for themselves and their family. Even if they're posting about their decision, I try not to make fun of them. But if you are someone who is making millions and profiting off of it, I think you're totally fair game. So if you are Joe Rogan, if you're, Aaron Rodgers, the football player who ruined my Sundays, I think it's fair game. Gwyneth Paltrow, you're fair game. So that's sort of how I differentiate. between that kind of situation and trying to engage someone in the public. Always lean on empathy in those situations. And I know you agree, but I would just say.
So great response, and I now understand why Elon Musk switched the name from Twitter to X. And Madhu, I'm delighted that you resisted the temptation of doubling your McGill salary. My goodness, that's quite something. Does anybody else want to comment on this question? And I'm going to look again to the audience. Please get your hands up. All right. So we got a couple of questions.
So mine is a little bit different. So I don't debate on Twitter. I don't waste my breath with the vaccine deniers. But there's a lot of people in that middle ground, and that's where I spend my time. And it's true. I have the luxury and the privilege of being people's family doctor, and we know that makes me a trusted source, and I can have that discussion with people. Honestly, just a couple weeks ago, I had one of my patients who's been patient for several years, had received the first 2 vaccines, and it was like, you know what, but I did the research, and there is like no way that I'm having any other vaccines. I'll go for the flu, but I'm not having any other vaccines of any other kind. I'm like, oh, why is that? And that simple question, and I teach my residents all the time, ask them, what brings you here today? Why do you say this? Gives you so much. And so that person pulled up a website. So he pulled up this website. He's like, this is the name of the website. It was on the list, actually. He pulled up this name of the website. I'm like, oh, and I read it with them. And I'm like, oh, well, actually, have you ever looked and I always, when I see information online, I do then a Google search where I say, is this trustworthy? And I put in whatever the X is. And I did that with them. And he was like, we get the first 2 or 3 search results were like, this is complete garbage. And so all of these things that were listed. So again, that's a one-on-one thing that I can do on my Facebook page. I can do on those things. But I'm not going to waste my breath and amplify the volume of vaccine deniers. I understand, and I too fear that this number is increasing. But I agree with Madhu that we need to politicize this and become more politically active. One of our family physicians at St. Mary's ran for politics, not with the intention of winning, with the intention of changing the dialogue. And that's what we need to do. So we not only need to get to vote, but we actually need to put ourselves up and run for office.
She was a great candidate for those very reasons. Good. All right. We have 2 questions. We're going to take both, comment or question. And yes, please, with the microphone. Yes.
Yes. So, Tim, you mentioned a lot of the ways that ideology, action, and misinformation correlate. And you gave the example of the town in, I believe, California, where folks were very left-leaning. And once COVID became a very left-right COVID issue, you saw a large uptake in vaccination. You also mentioned how a lot of misinformation seeks to erode one's trust in authority and in government. But I'm wondering, how much does it go the other way, wherein misinformation can be itself a sort of, not protest, but can be a manifestation of mistrust in one's government and a sense of letdown with current authority figures? Like, how much does that sense of disappointment give space for misinformation to then spread and grow?
Great question. And can you just finish by introducing yourself? Mr. Name.
Oh, hello. My name is Isaiah, and I'm currently a second-year Master's of Science in Public Health student.
Great. Thanks, Isaiah. Great question. Tim.
Yeah, it is a great question. And I'm going to respond first with sort of like my own speculation and then a little bit of empirical evidence. So my speculation is, I think a lot of it has to, because it ties in with the idea of community, right? I become part of this community because this community is really frustrated with the way the government has been treating us. I'm frustrated with my economic lot, and I blame the government for that in part. And we've seen that across. That's why I also think historical perspective is interesting, right? Because then you see the ebb and flow of who's trusting the government and the institutions. So during after Vietnam War, it was the left that was fundamentally distrustful of institutions. And, we had the civil rights movement, we had, assassinations happening, we had the Vietnam War, Watergate. And I think that's one of the reasons it's instructive, right? You embrace these counter narratives in part because you're protesting, right? You're protesting. There was really this interesting work by Stephen Lewandowski. This research was very recently published, and I'm blanking on the phraseology he uses, but he talks about the different kinds of truth. So I'm going to make up the phrases. These aren't the ones he used in his paper. It was an empirical study. There is a truth that is factual truth, and then there's belief truth. So the factual truth is sort of what we think of as misinformation. It's just factually wrong, right? But what happens is, when it becomes about your ideology, you don't care so much about that anymore. You believe about the belief truth. The misinformation speaks to your worldview. It speaks to your concerns, and that becomes the focal point. And what he did in his study is he analyzed, looked at a lot of the people that voted for Trump, the Republican movement, alt-right movement, and he suggests that kind of truth is, for them, their reality, and the factual truth is kind of beside the point because they believe in the bigger truth. Does that make sense? It's a fascinating study. If you look up Stephen Lewandowski, he's a great conspiracy theorist researcher from the UK. Very recent study, and I think it speaks to exactly the point that you just made, and basically supports your speculation.
Any other perspectives on that? Yeah, Ananya, and then we'll go to our next question.
Yeah, I mean, when we did our work in Park Extension, it was interesting when we actually asked them, why there was such high vaccine hesitancy in the beginning. Many people actually did articulate is that it wasn't that they didn't trust the vaccine. They didn't trust the Quebec government because this was a government that has been historically and to this day has widely neglected Park Extension, right? And they felt that, for them to get the vaccine wouldn't actually benefit their community at all, that it would just benefit the government so they can continue as precarious workers and keep the economy live. And that was, I think, really fascinating to me. And they said, because we've lost so much trust in our government, that when we do see misinformation, it's almost like, well, maybe this is more trustworthy than our institutions that we're part of. And I think this was like a largely common issue that was happening across communities in North America, right? When we were trying to really understand what vaccine hesitancy is. But I think what's important is to understand what is trust, right? And I think even among those who are anti-science and, anti-vaccines and so forth, I think we kind of have to dig deeper and kind of try to understand, where are their perceptions coming from? We really need to do a deep dive because I can't help wondering. So going back to that question, how do we communicate with people, who are just completely polarized from our views and beliefs? I think we actually have to, and remember these dialogues that happen between us, it's a power trip, right? And many people are just trying to gain power as much as they can. And that's why through fueling misinformation, getting traction, getting supporters is actually giving them a lot of power in the sense that it's the power that they've lost as a result of the institutions and the current governments. And so I think we need to kind of validate and kind of understand, and as Annick talked about, trying to understand what is the root cause of, why they don't trust the vaccine, why don't they trust, the credible information. Why don't they trust science?
Can I comment on that super quick? We've actually put in a couple grants on that exact question. So if there are any peer reviewers in the audience, I think you're exactly, what we want to find is, okay, you say you distrust this. Why? What's the justification that you're using? And our hypothesis is they're going to use misinformation to support why they distrust the rationale. But then you have to take a layer back from that, right? Where did you get it, and why does that accord with your values? I totally agree with you. I think this is a really important step that we need to take to figure out what's going on.
Great. We have another question here, and if you can just introduce yourself and your question.
Thanks so much for this panel. My name is Vaidehi. I'm a second-year student in epidemiology at McGill. And I'm curious, how do you all navigate in all your various diverse career paths, how to communicate uncertainty? I ask because of students of this program and in this field, we spend a lot of time discussing uncertainty and what it means for our research and our results and the value of it. And yet we look to like popular media or like campaigns out there, and the room for uncertainty is very limited, or sometimes it's not there. So I'm wondering, as students that are about to embark on careers in this field, how do we navigate uncertainty and not fall into these pitfalls that we know exist, but how do we be more constructive and productive about it at the outset of our careers?
Boy, the questions just keep getting better. Fantastic question. Thanks. Who wants to take a crack at that?
My forthcoming book is called...
And my winter course 614.
It's called The Certainty Illusion. It really is. So it touches on all of the the questions that you have. I wrote a piece for the Globe and Mail, a short one called The Uncertainty Dance. And I think often scientific community will say, oh, it's hard to talk about uncertainty. That's a lame excuse, because we have to, just because it's hard doesn't mean we shouldn't do it. And I really think we can do it. And I also think it's a justification for partnering with artists, partnering with comedians, with authors, in order to make uncertain science more shareable, more engaging, more meaningful, because science is exciting and interesting, and the uncertainty is part of that journey. And I think we need to do a better job communicating, and I think that's also part of the critical thinking, the education part of the equation. We need to teach kids that science is not a list of facts, it's a process, it's the grays, it's that are constantly shifting. It's clouds in the sky, right? And I think we need to do a better job doing that, so we prepare our citizens for engaging with that uncertainty.
Great. So we're going to have a series of comments here on uncertainty.
So I think one of the big things about communicating uncertainty is bringing it in from the beginning, but explaining it to the public in ways that they understand, and not be caught in our academic ways. And I'm at fault of this all the time, right? I have a PhD, and I spent for a while at UBC. I was the only I'm bilingual, so only francophone. So I was on Radio Canada all the time, and they tried to get me to epidemiology, switch into different lanes that I was not comfortable with. So I stayed within my bacteriology and virology lanes, but it's really important to be able to bring that to the public. But the other thing that I think we're missing, and I think we need to make sure that we include it in our research plans, in our grants, in our applications, and I'm so proud that we did in some of our recent work, is make sure that there are patient partners involved in our grant applications. We also have to make sure that the people on the ground who are actually doing the work with the people, whether that's the family physician or the ER doc or whatever, are involved in how we go about our research in the first place, as well as translating it to the public. And I think that is a big point, and you can use that, because if you can explain it to the patient partner what your uncertainty is, that patient partner will be able to turn that around and explain it and vulgarize it in a way that you'll understand, and the population will understand what you're concerned about.
Great. Thanks, Annick. Madhu or Ananya? Uncertainty.
So, I just kind of want to build up on what Annick is saying. I mean, uncertainty is part of it, but I think it's also how we've been trained scientifically, right? You think about the research methods, right? And when you think about when we were writing grants, our funders want every single detail. Don't forget the hypothesis, right? And so in science, we haven't been trained to actually bring uncertainty in our work, right? And that starts from the beginning of when we start to write the grant and then start collecting data. And it's really when we come to the analysis phase, we're looking at our data set and we're like, okay, the biostatistician comes and we're like, is it going to support our hypothesis or not, right? That is the first time we feel some uncertainty, right? And whatever way it goes, it's often a win or loss for us, right? Because we're so desperate to understand truly what is the relationship between the exposure and outcome, because that's all we've been trained, and to control for everything and anything out there. So I think we kind of have to bring the concept of uncertainty into our education, just like it's clear that's what our students are asking for, right? And how do we teach it? How do we communicate it also from a lay perspective? Because that's really important, because as you know, Annick and all of us can say, you know, one of the biggest struggles I know for me on a CI chair grant is to write that lay summary. Right? And that lay summary is actually intended for us to communicate our findings from our scientific studies to the general public, right? So there'll be an uptake in our findings from a policy perspective. Everyone's working at the policy. Like, we saw who was like running the show in terms of like making decisions during COVID. Very little of our politicians have a science background, right? And so I think part of that communication is to actually just normalize that it's okay, you know, if we don't have all the answers and questions now. And it comes back to just building that community and really enabling us to just have conversations to be able to work through the uncertainty.
Madhu.
I want the whole world to take an EPI 101 course, but I won't talk about that. I want to ask Tim a question I've been dying to ask him. So those of us who are very active in handling misinformation, many of us have been attacked, and attacked really badly. I have had some really hard times during this last 3 years, and nothing compared to the Peter Hotesses of the world. They've had it rough. Tony Fauci had armed guards protecting him. This isn't
Bonnie
just
Henry.
Yes, this isn't just a simple thing. This is really scary stuff, right? So when we take these risks in communicating to the public, and McGill encourages us to, McGill even has an award for public engagement, which faculty members get. So I love being part of a school that encourages me to engage with the public. But if I am attacked really badly, threatened physically, or if somebody slaps a frivolous lawsuit against me, will our universities protect us? Where is the recourse for people who've really, really stuck their neck out, and then we're left hung to dry because there is no protection for us? I know you've been at the receiving end of this. So how do we protect ourselves when we take these risks, and really important risks? We want to do good, but then we get mired into these sorts of crazy stuff that comes our way.
Yeah, it's a great question, and I have been sued, and I get death threats. I don't go into my office because people are looking for me. Whoa. And so it's, you know, they've taken down my nameplate, and it is really, you know, and it's daily hate mail, and you've seen my Twitter feed. It's like, and right now we're actually doing a study, and I think it's been accepted for publication on Nuremberg 2.0. Have you guys heard about that? So basically, it's this idea that we should be executed, right? That's, you know, Nuremberg 2.0 is a proxy for we should all be executed, right? And it's astounding how much is out there. And what's heartbreaking is I see my trainees are, you know, who are much smarter than I am, much more creative than I am, are hesitating to get involved in science communication because they're worried their institutions don't have their back. And in fact, just 2 days ago, we had our research team has a weekly meeting, and that's what came up. One of our researchers said, this woman wasn't involved in the call, but her colleague was. He said, you know, she doesn't want to be involved in this paper because she's worried about getting sued. Are we recording? Maybe I won't even say I won't say who it is to respect her decision, but it is really sad. And so I think what we need to do is institutions need to make protecting those voices a priority, an absolute priority. There was an interesting piece in Nature yesterday where a woman in New Zealand is suing her university for not having her back. I don't know if you guys saw that. Now, I don't want to get into the details of that one, but I think institutions, McGill, also public hospitals should clearly protect those colleagues that are out there trying to fight the good fight, and that includes trainees. We need these voices. We need diverse voices to be part of the community. Now, the good news is, and I think everyone here was probably scaring anyone away from wanting to get involved. The good news is it's fantastically rewarding. The Canadian science communication community is amazing. It's a fun, warm, supportive group. Am I right? It's just incredible. And so come be part of that community. And the other thing you can do is you can pick a very narrow topic that you feel very comfortable with, that maybe is not going to be as challenging. But I absolutely think we need to reward. Look, I'm old. I don't need, to be rewarded for this. We need to make sure junior faculty are getting reward for this action. So it should be part of their faculty evaluation. It should be it should be viewed as not something you do off the side of your desk, but central to your function. It should be part of research grants. Funding agencies like the CIHR should be rewarding people for doing this. There should be grants just for doing this. All of those changes need to happen. And the good news is, I think it's starting to. And I will end this one last thing. The University of Alberta did support my lawsuit, and we won the lawsuit. But I know other institutions didn't, right? And that's a shame. That's a shame. I also have my own private insurance because I'm worried about getting sued, which is horrible. And it's thousands of dollars a year, and students can't afford that. And in addition to that, I don't think you can get it anymore. I don't think you can get it anymore. I was lucky I got in before this became an issue, and I think most insurance companies won't insure people in this domain.
Well, yeah. Would you like to? Okay. So I think I'm getting little knowing nods from our orchestrators, and I just think it's such a delight to have a true feast before dinner in terms of getting, veritable insights to an issue which is really defining of our age, and one that perhaps wasn't on the radar screen even 10 years ago, but which is so fundamental to the academy, because we have a fundamental role in the generation of knowledge and in the training and in constituting or defining what constitutes veritable science. And we have a lot to learn. I think that's what we're hearing. We talked about the extent to which we're teaching people about uncertainty. In the context of sweepstakes education, where it's a race to the top, and you're only legitimate if you're perfect and get a 4.0, what does that say about those who don't? Which is the majority of us. I never got over 2 on my GPA. That's why I have such uncertainty. But to me, the issue is, if we're going to build momentum, as Ananya is encouraging us, as partners, if we're going to be honest and be colleagues, true colleagues with our patients, but if we're going to be activists, as Madhu is suggesting, that we have to take science to the streets, and we're going to do that in a way that Tim seems to be able to do in his sleep and through his multiple books and publications, then it is perhaps one of the most fundamental issues of our time. So the momentum here is clear. Science up first. Tim, I think you've got all sorts of ambassadors here in the audience. And with that, I just wanted to thank you in particular and our panelists for an absolute fundamentally fantastic seminar. Thank you.
Thanks so much to the panelists, and also to Dr. Tim Evans, who is an excellent moderator as always. I'm going to pitch him a podcast. He should join sometime in the future. I think I have to remind my mom to get off the WhatsApp groups after listening. We have some appreciation for the panelists. Rebecca Zhao, our manager of gifts, will bring them to you, just to show appreciation. Yeah, for you. Oh, yeah. I also want to acknowledge behind-the-scenes giants who helped to bring this event together. I'm a PhD student, and without their help, I wouldn't have been able to pull this together. So I want to thank Marie Boncourt, who has been amazing. Jesse Rads, always kind. Kevin O'Neill. Stephanie LaRoche-Pierre. Also Priyanka Saxena. Also our team, Alua, Isabel, Dominic, Rebecca, and Abdul. I appreciate you all coming out tonight. I hope you all took some great advice from this panel, and have a wonderful night.
Wait, before you go, we just wanted to share. Anyone who knows Shashika knows that he's always been a tireless advocate for health equity for everybody. And we just really wanted to show our appreciation for Shashika for taking the initiative to plan this event. You guys have no idea how hard he's been going in the email chains, the group chats. So as a token.
Thanks, everyone. Have a good night.